We are doing primary RIRS since the scopes, accessories are becoming smaller and smaller. The successful access rate nowadays has come up to more than 95% without pre-stenting. Hello, I'm Dr. Anil Shrestha from Kathmandu, Nepal. Flexible ureteroscopy is one of the most commonly performed procedures for treatment of kidney stones all over the world because of its proven safety and efficacy. We have seen significant technological advancement in last few years, namely miniaturization of the scopes, improvement in vision of the scopes, laser technologies, and accessories. Today, we are performing two unique cases using single-use flexible digital ureteroscopes of 6.3 French from HugeMed with the use of fan sheath. I think these two cases will highlight the advantages of miniaturizations of scopes in the treatment of kidney stones in endourology. The first case is 37 years old female. Stone size is pretty large, 24 millimeter in size, partial staghorn in lower pole with a total stone volume of 2640 millimeter cube. Let's see if we can insert the fan sheath. If fan sheath is accessible, I think we'll be able to clear the stone in one session with the use of, again, 6.3 French flexible ureteroscope from HugeMed. The patients are not pre-stented. Earlier, when flexible ureteroscopy was started, the main issue was access because of the bulky or very large ureteroscope. Back then, we used to pre-stent almost all the patients. So this is a very slim scope because we have thin ureteroscope. We focus more in stone treated nowadays, like zero fragment residual procedures or the complications. Generally speaking, the indication of flexible ureteroscopy is up to 20 millimeter stone, but with the introduction of smaller and flexible access, navigable access sheath fans, we do slightly bigger stone with complete clearance without necessity of auxiliary procedure or stage procedure. We can complete the procedure in one stage with the use of fans. Let's see if we can use the fans in this patient. With this scope, we will be using a fans access sheath, well-lead Cleopatra of 8.5 size, which is perfect match for this 6.3 scope, which is 40 centimeter in length. You can see the suction port at the proximal end and the suction vent here, the obturator, and you can see the distal 10 centimeter of fans tip is very flexible, which is very helpful in navigating lower pole and difficult calyces inside the kidney. The patient is not pre-stented, so we are doing primary RIRS since the scopes, accessories are becoming smaller and smaller. The successful access rate nowadays has come up to more than 95% without pre-stenting. So these small scopes are very handy for a patient like this. This scope comes with the processor with compact screen which can be connected with the main screen in the operation theater so that it becomes more ergonomic. You can use your existing screen in the operation theater, and the vision of this scope is exceptional. You know, this is the single-use digital scope of 6.3 French. The vision is something like a rod lens. This scope, particularly this scope, has one of the best vision. Vision is not an issue with a digital single-use scope anymore. But of course, when the vision is good, surgeon is comfortable, the operative duration goes down, and there are less chance of complication when you have a scope with a good vision. Whereas the second case is 5 years old child with 8 millimeter stone in right renal pelvis. There is a stone in right kidney, right pelvic-ureteric junction of around 8 mm in size. Patient was stented for last 4 weeks. I think the duration of stenting is pretty long, but of course that will help. We have miniaturized scope these days, so access should not be a problem. So we'll do this kid with the slimmest or thinnest flexible ureteroscopy that is available. When you are navigating distal difficult calyces, you can rotate the distal tip with the knob here and navigate it's around 180 degree rotation is possible. It's quite helpful when you have to enter the difficult lower pole or difficult calyces in any pole of the kidney. You see, we can navigate. The calyces are very narrow and very small in this 5-year-old child, but because of the small size of the scope, we can easily enter all the calyces. This is the upper pole, compound calyx, upper pole. Okay, so this is the lowermost calyx. Now the stone is in the pelvis. You can see the stone is not very hard. Looks like a calcium oxalate dihydrate to me. It has spiky surface. Looks fragile, so I'll proceed with subsequent lithotripsy now. With I'm using thulium fiber laser from Quanta Fiber Dust 60 watt, but the laser setting for this particular stone will be very minimal. I'm using 200 micron laser fiber. My setting for this particular stone in this child will be 600 millijoule, that is 0.6 joule with 12 frequency. I'll start with this laser setting and I'll see if the setting is correct for me. So we'll try to dust it completely and then suck all the dust with the access sheath. Okay, so the stone has gone to lower pole now. It's not an issue with this fantastic scope. I can be in the lower pole, dust it.